Hello, hello, everyone. Welcome, welcome. Super excited to see you all. I say this every time, but it is the truth. I love seeing all of the names as you guys get into the room and seeing familiar names. So, hi, if we've met, it's really good to see you again. If we haven't met yet, it's really nice to see you and meet you here. It's always fun to see new names too. Got a big group today, so really excited about that. We all love talking about gut health. As people are trickling in, would love to get to know a little bit about you. If you want to say hi, you're welcome to in the chat. Also, our goal is always to meet you. So I would love to know where you are in the world, how you heard about the webinar today. If you're open to that, you can drop it in the chat. Or if you want to send it in the QA box and stay anonymous, happy to look there as well. So fun. Oh, you got the horse symbol from Kentucky, of course. Our family has a horse. We love horses. So hello, hello. All over the world. India, wow. Pittsburgh, so cool. Washington State. I love seeing everybody from all over the world. It's really neat. Yes, Florida is hot. You are right. It is really hot in Texas where I am as well. We've had heat index of like 110, 115, that high humidity. I feel you. Colorado, you've got the drier air. I'm a little envious right now. Northern VA, awesome. Yes, welcome everyone. Yeah, and again, if you're open to sharing where you heard about the webinar, we love to get the word out about these. So I would love to know that as well. It's always really cool in many ways people come into the webinars. I find myself on LinkedIn a lot. Some people are social media, some follow our website. It's just always neat to know. Oh, cool, Samuel. Yeah, very interested in gut health. Yeah, whenever we have that personal connection. We're actually going to talk a little bit about celiac disease too, which my son has celiac disease. So I totally understand that personal connection. All right, guys. Well, we're going to dive in. Feel free to keep dropping that in the chat because definitely love to check it out and hear from you. But we're going to talk about that gut feeling, gut health matters, and coaching. So in case we have not met yet, my name is Ashley Honeycutt. I am the Director of Health Coaching Operations here at YourCoach Health, as well as a board-certified health and wellness coach. I've been a coach for about 8 years. I was into health and fitness before that and was an educator as well. So these webinars kind of take all of my passions and put them together. It's really neat. And I absolutely love working for YourCoach. We do so many really neat things like this webinar. If you haven't met us yet, you haven't met YourCoach, it's my pleasure to officially introduce you and welcome you to YourCoach.health. We are the only operating system for behavior change powered by health coaches. Our industry partners entrust us to stand up or augment their health coaching operations utilizing our APIs, widgets, and tech-augmented army of validated and credentialed health coaches, which surround their existing product or service. We're the premier virtual home for health and wellness coaching, an ecosystem built to empower health coaches while expanding access to their services through our industry partnerships. So for you, our coaches, this enables us to work. I'm a coach as well, work in our HIPAA compliant platform, which is tailor-made for health and wellness coaches by a health and wellness coach. Our platform is designed to give you everything you need to run your practice smoothly. So that's going to be the HIPAA compliant chat and video sessions, session notes, a food logging diary, and a comprehensive library of resources, plus many other things. My favorite being contracting opportunities for coaches with our industry partners, and that's for our validated and verified coaches practicing on the platform. At YourCoach, our mission is to create a world where every individual has access to a health coach by 2030. So in short, creating more happy and healthy humans, which is what we all aim to do, right? So before we start, gut health can mean lots of different things. There's lots of different confidences in it. I would love to know, how confident do you feel in coaching around gut health? So on a scale of 1 to 10, with 1 being it gives you immense anxiety and just the desire to run away, to 10 being fully confident and ready to tackle any gut health issue that your client may bring forward, where do you land? And it's okay to be anywhere on the spectrum. Sometimes depending on the season, it's different for me. So I love seeing these in the chat, lots of different numbers. I know for me personally, while I, in the beginning of coaching, felt confident in coaching, some of the gut health challenges felt a little scary to touch on. And I was also wary of scope concerns. So if you want to, along with that chat and the numbers, let us know what topics you feel less sure about when it comes to gut health. We can try to tackle some of those as we go through the presentation. Love seeing all the different numbers. So why is gut health important? As you continue to drop those in the chat, we'll just kind of start talking about the importance of gut health. The gut refers to, of course, the gastrointestinal system. It encompasses organs such as the stomach, the intestines, the colon. Its primary functions are digestion, absorption of nutrients from food, and eliminating waste. The concept of gut health can vary even among researchers, medical professionals, and the general community, lacking a precise definition. So in this context, for today, we're going to define gut health as the presence of a healthy gut microbiome and the absence of significant digestive symptoms. So approximately 200 different species of bacteria, viruses, and fungi coexist, or fungi, depending on what part of the world you're in, we pronounce it differently, tomato, tomato, right? Coexist within your large intestine. Collectively, these microorganisms form your gut microbiome. They play a crucial role in breaking down food, converting it into nutrients that your body can utilize. Our digestive system plays a crucial role in our overall health. We're going to talk a lot about this, and maintaining a healthy gut is essential for our well-being. So there are established connections between gut health and several aspects of well-being, including things like the immune system. The gut plays a pivotal role in immune function. The gut microbiota interacts with the immune system, influencing its development and activity. A healthy gut microbiome helps regulate immune responses and defend against pathogens, reducing the risk of infections and promoting overall immune system balance. The gut-brain axis facilitates bidirectional communication between the gut and the brain. We're going to dive more into this in a minute, but the gut microbiota produces neurotransmitters and communicates with the central nervous system, influencing mood, emotions, cognitive function, and imbalances in gut bacteria have been associated with mental health concerns such as anxiety and depression. Also, emerging research suggests that gut health is linked to the development and progression of autoimmune diseases. The gut microbiota and intestinal permeability play a role in immune system dysregulation, potentially triggering or exacerbating autoimmune conditions. The gut microbiome has been implicated in metabolic health and the development of endocrine disorders like type 2 diabetes. Specific gut bacteria can affect glucose metabolism, insulin sensitivity, and inflammation, all this contributing to the risk of developing metabolic disorders. Gut health directly impacts the development and management of gastrointestinal disorders, imbalances in that gut microbiota, alterations in gut permeability, and abnormal immune responses can contribute to the onset and progression of conditions like IBS and IBD. Again, we're going to dive much more into those. Surprisingly, too, I found this one surprising anyway. Emerging evidence suggests a connection between gut health and cardiovascular health. So gut dysbiosis and inflammation can contribute to the development of atherosclerosis, I have to say that slow, hypertension, and other cardiovascular conditions. Additionally, the gut microbiota can influence cholesterol metabolism and the production of certain compounds associated with cardiovascular health. Also, the gut microbiome has been linked to the development of certain types of cancer, including colorectal cancer. Dysbiosis and chronic inflammation in the gut may promote carcinogenesis, highlighting the importance of that healthy gut environment in cancer prevention. And also it can influence sleep patterns and quality. Disturbances in that gut microbial composition has been associated with sleep disorders such as insomnia and sleep apnea. And the gut-brain axis and the production of neurotransmitters by gut bacteria can influence sleep regulation. Also digestion. Of course, I think this is the obvious one we all think of, right? Gut health directly affects digestion and nutrient absorption. A healthy gut microbiome helps to break down food, enhances nutrient extraction, and promotes optimal digestion. Imbalances in that gut bacteria can lead to things like bloating, gas, and irregular bowel movements. I think those are the ones we expect, right? Now, this is a really cool thing. If you've ever relied on your intuition or experienced nervous anticipation in your stomach, we can be tapping into this intriguing source that we call the second brain. So your second brain, right? Contrary to common belief, the digestive system houses a remarkable brain in your gut. It has been reshaping the medical field's comprehension of the interconnectedness between digestion, mood, overall health, and even cognitive processes. This extraordinary neural network, known as the enteric nervous system, otherwise called the ENS, that's what we're going to shorten it to from here on out. It's far from insignificant, even though it's small. It's comprised of two delicate layers of over 100 million nerve cells, and the ENS forms a lining along the entire gastrointestinal tract from the esophagus to the rectum, and it has many special functions. The ENS is highly sensitive to various stimuli within the digestive system. It can detect and respond to changes in the gut environment, such as the presence of food, composition of nutrients, or the presence of harmful substances. And this sensitivity allows the ENS to initiate appropriate responses to optimize digestion and protect the gut from potential harm. One of the primary functions of the ENS is actually to regulate the movements of the intestines, known as intestinal motility. So the ENS controls the coordinated contractions and relaxations of the intestinal muscles, which enables the proper mixing, propulsion, and absorption of food throughout the digestive tract. And this rhythmic muscular activity is essential for efficient digestion and the movement of waste materials towards elimination. And of course, secretion. So the ENS also plays a role in regulating the secretion of digestive juices and substances within the gastrointestinal tract. It controls the release of enzymes, acids, mucus, and other substances necessary for the breakdown and absorption of nutrients. So these secretions aid in the digestion and absorption of food components, ensuring optimal nutrient uptake by the body. So together, all of these unique features of the ENS contribute to its intricate control over the digestive process. So by sensing, coordinating motility, and regulating secretions, it helps to maintain the balance and efficiency of gastrointestinal function. Dysfunction or disruptions in any of these features can lead to digestive disorders and disturbances in the gut health. It's important to know there's a lot of medical terminology. There's a lot of things that happen here. We don't have to be experts in this. I think it's just helpful to have a little bit of a background on it, just so we can kind of see how it works, but don't worry if you're like, oh, that's complicated, because it absolutely is. So let's talk about the gut-brain axis. Mental health and gut health are closely intertwined through a bidirectional communication system known as the gut-brain axis. The axis refers to the constant network of communication pathways between the gastrointestinal tract and the brain. So it involves neural, endocrine, and immune signaling. The gut microbiota, that diverse community of microorganisms, plays a crucial role in maintaining gut health. So these microorganisms produce neurotransmitters that include serotonin. And of course, serotonin is what regulates mood and emotions. Actually, interestingly, about 90% of serotonin is produced in the gut, which highlights the influence of that gut microbiota on mental well-being. I think that's pretty cool. Disruptions in the composition of the gut microbiota, known as dysbiosis, have been linked to mental health conditions such as anxiety, depression, and even neurodevelopmental disorders. Furthermore, the gut-brain axis is involved in regulating stress responses. So stress, we know, can affect the gut health by altering that gut microbiota, which increases gut permeability and impacts the release of stress hormones. Now, conversely, imbalances in gut bacteria and gastrointestinal disorders can also contribute to stress and anxiety. So remember, bidirectional means the brain is talking to the gut is also talking to the brain, and you kind of get which came first, the chicken or the egg, right? Stress causes digestional upset, but digestional upset also causes stress, right? It's this weird kind of a loop. The relationship between the brain and the gut is evident in our language and our experiences. So expressions like gut wrenching or feeling nauseous when you're kind of upset, or having butterflies in the stomach when you're nervous, reflect the sensitivity of the gastrointestinal tract to our emotions. The brain influences the stomach and the intestines directly, as even the thought of eating can stimulate the release of stomach juices. Conversely, a distressed intestine can send signals to the brain, and a troubled brain can impact the gut. So this interplay can create a cycle where stomach or intestinal distress becomes both the cause and the result of anxiety, stress, or depression. Now remember, within our gut, there's that ecosystem of trillions of bacteria that's existing, and that's consisting of both beneficial and potentially harmful strains of bacteria. These bacteria play crucial roles in maintaining our health and performing essential functions. So they do things like protect against bacteria that cause disease. So beneficial gut bacteria act as a barrier, preventing the growth and colonization of harmful pathogens. They compete for resources and produce antimicrobial substances that inhibit the growth of disease-causing bacteria. That protects our gut and our overall health. The gut microbiota also plays a pivotal role in developing and regulating the immune system. It helps train and modulate immune responses, ensuring an appropriate balance between tolerance and defense. By interacting with immune cells in the gut-associated lymphoid tissue, the gut microbiota helps support immune system function and defend against infections. And the obvious one that we all know, helps with digestion. So, right, it helps in the breakdown of complex carbs, fiber, and other components of our diet that our digestive enzymes cannot be processed on their own. So they help to produce enzymes that break down these substances into more easily absorbable molecules, facilitating digestion and the extraction of nutrients from our food. Now, various factors can disrupt this very delicate balance of gut microbiota and lead to gut-brain dysfunction. So some of those things that can do that are stress. We've talked about how stress and that gut-brain axis can interact. Early life stress and traumatic experiences that can have long-lasting effects on that gut-brain axis. So they can impact the development and function of that gut microbiota, increase gut permeability, and contribute to the risk of developing gastrointestinal and mental health disorders later in life. Of course, anxiety and depression, we talked about this in the gut-brain axis. GI symptom-related anxiety or hypervigilance or attentional biases, as you may have heard. So that's where people who are experiencing gastrointestinal symptoms, such as IBS, like an example, may develop anxiety and hypervigilance towards the sensations. And then this attentional bias can further contribute to gut-brain dysfunction, perpetuating this cycle of stress and gastrointestinal symptoms that just kind of keeps going and keeps rolling. It's almost like a snowball effect. Visceral hypersensitivity, that's that increased sensitivity to gut sensations where normal physiological, so the physical ones, signals from the gut are perceived as more intense or painful. So this heightened sensitivity results from the altered gut-brain communication and contributes to the experience of gastrointestinal symptoms. Of course, certain medications like antibiotics can disrupt the balance of the gut microbiota, both eliminating the beneficial and the harmful bacteria. Prolonged or excessive use of antibiotics can lead to dysbiosis and gastrointestinal disturbances. Disclaimer, I am not saying to not take your antibiotics. Antibiotics can be a wonderful thing. We just need to care for our gut when we do take them. And of course, diet and nutrition, we know this one. Our gut is really influenced by the type of foods that we consume. So a diet high in processed foods or sugar, low in fiber can negatively impact our gut, leading to things like inflammation, imbalances in that gut microbial community, and compromised gut-brain axis function. So now that we know the what of the gut, we've learned the technical parts of it. Again, this is gut health 101. If we were to ask a doctor, we could be here for months and months and months talking about this. We're just doing an overview. But with the what of the gut, let's explore some common gut health issues our clients may encounter. So there are far more than we could possibly ever cover together here in an hour. So we're going to focus on some of the most common. So the first one here is gastroesophageal reflux disease, or GERD, which is much more easy to say. It's a common gut health issue characterized by the backflow of stomach acid into the esophagus, leading to symptoms like heartburn and regurgitation. There's also celiac disease. It's an autoimmune disorder triggered by gluten consumption, causing damage to the small intestine and necessitating a gluten-free lifestyle. There's also irritable bowel syndrome and inflammatory bowel disease, IBS and IBD. They're two prevalent conditions that affect the digestive system. They cause significant discomfort and disrupt daily life. And finally, food intolerances. That's where the body struggles to digest certain substances, and that can lead to digestive symptoms and discomfort. Identifying trigger foods is really crucial for maintaining and managing food intolerances. We're not going to delve deeper into this one today, but I think it's important to note as a potential challenge to a healthy gut. So a lot of us were trained on food intolerances throughout our programs, and it's definitely something worth diving into, but we're going to focus on the other ones for today. And of course, we're going to learn potential coaching strategies to support our clients as we go through them. So when we look at these as a whole, though, any kind of gut health things, there's some universal strategies that are helpful across the board. We have tons of tools in our toolbox as coaches, and this is just a small sampling of coaching skills that we use all the time that can be beneficial to clients with digestive concerns as well. Of course, we can educate. We can provide clients with accurate and up-to-date information about gut health. We can explain the importance of a healthy gut microbiome, the impact of lifestyle factors on gut health, and common gut health issues. This knowledge can empower clients to make informed decisions about their health. A lot of times they go to the doctor, they get handed this paperwork. It's overwhelming. It's a lot. They don't understand it. Maybe it's not in an easily digestible form for them. No pun intended, since we're talking about digestive stuff, but that works pretty well. And we can help them parse through that. We can see what they understand, what gaps they might have in their knowledge, and then we can educate by providing reputable resources to fill in those gaps. We can also encourage and give motivation to clients as they navigate their gut health journey. So this can involve highlighting the benefits of adopting gut-friendly practices, such as maintaining a healthy and balanced diet, managing stress levels, engaging in regular physical activity, all of those healthy lifestyle things. Of course, support. We can provide emotional support in a safe space for clients to express their concerns and challenges related to gut health. By actively listening and empathizing, we can help our clients navigate any emotional or psychological barriers that they encounter. Decisional balance, I love this one. So we can assist clients in weighing the pros and cons of lifestyle choices and behaviors that impact gut health. So by facilitating that decisional balance process and all of the curiosity that comes with it, and really diving in there and giving that evoking process a chance to blossom, coaches can help clients assess the benefits and potential obstacles associated with making those changes, ultimately, hopefully guiding them towards effective strategies for that change. And the most important one, in my opinion, is really to empower. This is where we empower clients to take ownership of their gut health by fostering that self-efficacy and that confidence. So we can do that through setting realistic goals, celebrating achievements, providing ongoing support. And as we do each of those things, we're instilling that sense of empowerment in our clients, enabling them to make sustainable changes and maintain their healthy gut throughout their life. So let's dive into some of those conditions that may be affecting our clients and inhibiting their healthy life. Irritable bowel syndrome, or IBS as we're going to call it from here on out, is a common gastrointestinal condition characterized by recurring episodes of abdominal pain or discomfort, often associated with changes in bowel habits. It affects a significant portion of the global population with an estimated 5 to 10% prevalence. IBS can occur in individuals of all ages, all genders. Although IBS does not lead to a shortened lifespan, it does impose a substantial burden on the healthcare systems and the economy because research has indicated that individuals with IBS tend to have more frequent healthcare visits, undergo more diagnostic tests, and sometimes require surgeries. And most importantly, because we're all about creating happy and healthy humans, IBS can have a profound negative impact on a person's overall quality of life. So common symptoms of IBS encompass a range of gastrointestinal discomforts. They vary in severity, they vary in frequency among individuals, but they may include things like recurring abdominal pain or discomfort. So that can range from mild to severe, and the pain is typically described as cramping or aching and may occur anywhere in the abdomen. Many individuals with IBS experience bloating. That's that sensation of increased abdominal fullness or distension, and it can be accompanied by excessive gas production, leading to flatulence. It can disrupt normal bowel movements, leading to stool consistency and frequency alterations. So some individuals may experience diarrhea, while others may have constipation involving that infrequent or difficult passage of stools. And it's possible for individuals to alternate between periods of diarrhea and periods of constipation. Also an urgency to have a bowel movement. It can cause a sudden and intense urge, which may be difficult to control. And that urgency can really be distressing and can really contribute to anxiety or maybe avoidance of certain situations, particularly social engagements or leaving home. And that can be something really worthwhile to coach around and talk about and provide a safe space to explore. Another common symptom is mucus in the stool. The presence of mucus is generally harmless, but it can be really alarming to individuals experiencing it. And it's important to note that these symptoms can vary widely among people diagnosed with IBS, and not everyone's going to experience all of these symptoms or experience them all at the same time. They may come and go. They may also be accompanied by other non-gastrointestinal symptoms. So things like fatigue, headaches, sleep disturbances, all of that can further impact a person's overall well-being. And there are a few risk factors for IBS. So remember, it can be any age, any gender, but there are some known risk factors. So being under the age of 50 is definitely one. In the United States, it's more common in women. So estrogen therapy before or after menopause is also considered a risk factor for developing IBS. Family history of IBS increases the chances of developing the syndromes. This could be due to shared genetic factors, environmental factors within the family, or a combination of both. And mental health challenges. So anxiety, depression, other mental health conditions are more susceptible to IBS. So, and then on the right-hand side here, you're going to see a breakdown of the type percentage of population with different types of IBS. And you'll see that mixed IBS is the most common. So it's going to be where they alternate between periods of diarrhea and constipation, followed by IBS with diarrhea as being the next most common. So some coaching tools that can be particularly helpful with clients with IBS or IBD are food logs with symptom trackers. So we can encourage and support clients to maintain a food log that tracks their dietary intake and any symptoms experienced. This tool can really help identify potential trigger foods or patterns, enabling the clients to make informed decisions about their diet. So by analyzing that food log and symptom tracker together, clients can identify correlations between specific foods and gut symptoms, guiding them in making appropriate dietary modifications and/or discussing those observations with their clinician. So fun tip, the YourCoach platform has a food log where clients can make notes along with their meals, and then they can even share those meals and notes with you. So super cool. Stress can also significantly impact gut health. So this could be stress reduction techniques like deep breathing exercises, meditation, mindfulness, relaxation techniques, anything that will help that client manage their stress levels. We can also offer education to clients about the potential benefits of probiotics for gut health. So this can provide information about different strains of probiotics, their role in maintaining a healthy gut microbiome, and how to select appropriate probiotic supplements. Coaches can help clients understand the importance of consistency in probiotic use and support them in finding the right product for their specific needs. Now, it's super important here, we're going to pause, that coaches should not prescribe or recommend specific supplements or sell supplements or vitamins to their coaching clients. And that's in order to stay in line with the scope of practice and the code of ethics. Assuming that your client has expressed interest in probiotics, you might say something to them like, selecting the appropriate probiotic supplement can depend on various factors, such as your specific health needs, and any existing digestive issues and the strains of bacteria that have been researched for these particular conditions. As a coach, I can provide you with educational resources to help you understand the different strains and their potential benefits. And it's important to note that I cannot prescribe or recommend specific supplements, as that falls outside of my scope of practice and ethical guidelines. However, I can absolutely support you in finding reliable sources of information and feeling confident discussing them with your medical professional. So there's a lot of opportunity for education and engagement there. And of course, physical activity has been shown to affect gut health positively. So we can work with clients to identify and then engage in regular exercise tailored to their abilities and their preferences. Exercise can improve gut motility, reduce stress, and promote overall well-being. And then medication or clinician's prescribed plan. So in some cases, clients with gut health concerns may require medication, or they may have a prescribed plan from their healthcare professional or maybe their registered dietitian. And we can support the clients in adhering to their prescribed treatment regimen, ensuring that they understand the instructions to it, mitigating and planning for potential side effects, and the importance of regular check-ins with their healthcare provider. We can also help clients navigate any challenges or concerns related to that medication or treatment plan, including setting up medication adherence plans and goals. So let's look at a case study. Emma is a 32-year-old office worker who's been struggling with IBS for the past few years. She frequently experiences abdominal pain and bloating, and her bowel movements alternate between diarrhea and constipation. So she's got that mixed IBS that's most common. These symptoms have affected her quality of life and made it challenging for her to focus on her work. What stands out to you first about Emma? I would love to know, like, as you read this, what are your thoughts on coaching tools that you could use with her? Again, you can drop these in the chat. You can put them in the Q&A. Love to hear what you guys think and what your first kind of go-to way to support Emma would be. I'll kind of walk through my perspective, as a coach. If I was working with Emma, my primary goal would be to provide her with comprehensive support in managing her IBS symptoms and, of course, improving her overall well-being, right? That's what we're here, happy and healthy humans. So I would approach our sessions with empathy, with curiosity, really creating that safe space for her to share her experiences and concerns openly. I would express genuine interest in her journey with IBS and its impact on her daily life, her emotions. She's mentioned work productivity. That could sound something like, I'm here to listen and support you, Emma. Your experience with IBS matters. And together we can find strategies to help you manage your symptoms and regain control of your well-being. Would you be open to telling me a bit more about what your experience with IBS has been? That provides a safe space for her to share whatever she's comfortable with. And also, really importantly, gives us a window into what is most important to work with her on first. To empower Emma, I would provide her with valuable resources for education about IBS, its potential triggers and strategies for symptom management. By equipping her with knowledge, I aim to help her better understand her condition and the factors contributing to her symptoms. So while I can offer her some support and some guidance, she's the expert in her own body, and she absolutely has the power to make informed choices about her health. So saying something like, knowledge is power, Emma, By understanding how IBS affects your body and identifying potential triggers, we can work together to develop a personalized approach that suits your needs and helps improve your symptoms. It can be really powerful to let her know she's not alone and that you're here to support her and walk this journey with her. I can also gauge her interest in using a food log and a symptom tracker to better understand the relationship between her diet and her symptoms. We can identify patterns and potential trigger foods by keeping track of her dietary intake and then the corresponding symptoms. This can be a really valuable piece of information if she's working with a registered dietitian, or even for her medical professional, right, her doctor. This process would enable her to develop that personalized eating plan that aligns with her preferences and reduces the severity of her symptoms. Also, I think it's important to recognize the impact of stress on IBS symptoms. So again, exploring those stress reduction techniques with the Emma could be really, really powerful. It can be really stressful to attend work events or even go into the office when you're not confident that your digestive system's ability is going to behave while you're there. And this can lead us to maybe working on some coaching sessions and talking about plans for scheduled bathroom breaks or how to navigate meetings when her tummy's not feeling great. And to combat stress as a whole, of course, we could lean on all of those stress reduction techniques, deep breathing, meditation, mindfulness, all of those kind of things. And then digging into ways that she practices self-care to help her find joy and help her relax. So saying something like, managing stress is an essential part of our journey, Emma, and you've mentioned that stress you feel around managing your symptoms. How would you feel about exploring different stress reduction techniques and finding what works best for you? What have you tried in the past that you've loved, or what's something that you haven't tried but you would like to? Again, we're going to serve as that source of continuous support and accountability for Emma, checking in regularly, addressing those challenges and concerns, and empowering her to make any necessary adjustments to her plan. Lots of different directions we can go with her. At the end of the day, we want to improve her quality of life, help her feel empowered to manage any symptoms, and of course, to regain her focus and productivity at work, since she mentioned that as one of her first things. So let's talk about inflammatory bowel disease, IBD. It's a chronic condition characterized by inflammation in the digestive tract, and approximately 1.6 million Americans suffer from IBD, with an additional 70,000 new diagnoses each year. So there's two main types of IBD, Crohn's disease and ulcerative colitis. Both conditions share similarities in terms of symptoms and the impact on daily life. Crohn's disease can affect any part of the digestive tract from the mouth to the anus. It often causes inflammation in patches, which can lead to complications such as strictures, fistulas, and abscesses. On the other hand, ulcerative colitis primarily affects the colon and the rectum, causing continuous inflammation and ulcers along the colon's lining. So common symptoms of IBD are things like inflammation in the digestive tract, which causes discomfort and persistent abdominal pain. The severity and location of the pain can vary depending on the specific type and location of the inflammation. Chronic or recurring diarrhea. It can be accompanied by the urgency to have a bowel movement and can lead to frequent trips to the bathroom. Inflammation and ulceration in the colon and the rectum can result in rectal bleeding. So blood in the stool can be visible and occur as dark or tarry stools. Reduced appetite, malabsorption of nutrients, and increased energy expenditure due to the inflammation can contribute to unintended weight loss in individuals with IBD. And of course, chronic inflammation in the body's immune response can cause fatigue and general feelings of tiredness even after adequate rest. There can be a fever, a low-grade fever present because that inflammation and the immune system activation triggers that low-grade fever, especially during periods of disease flare-ups. And reduced appetite and decreased food intake can occur due to abdominal discomfort, nausea, or a general feeling of just being full, that fullness. Living with IBD can be challenging just because it is unpredictable in the nature of its symptoms and the impact in daily life. Individuals with IBD can experience periods of remission where symptoms are minimal or absent even, followed by periods of flare-ups that are characterized by increased symptom severity. Individuals with IBD really need to work closely with healthcare professionals to manage their condition, and that can include things like medication, lifestyle modifications, and ongoing monitoring of disease activity. Now, along with those symptoms, there are risk factors that are definitely worth mentioning. Genetics can play a significant role in developing the IBD, as scientific evidence supports the hereditary nature of the condition. So studies have revealed that approximately 5 to 20% of individuals have IBD, also have a first-degree relative. So first-degree relative is going to be a parent, a child, or a sibling who also has the disease. Children of parents with IBD are at a higher risk of developing IBD than the general population, with a greater risk associated with Crohn's disease than with ulcerative colitis. And the risk further increases when both parents have IBD, as one study found that 36% of individuals with two affected parents later developed IBD. So while genetics are implicated, and we certainly see a connection here, the association is really complex, and multiple genes likely contribute to the disease. So the presence of genes associated with IBD does not guarantee the development of the disease, but rather it just increases the chances of its occurrence. So other factors, including environmental factors, can also play a role in the development of IBD. So regarding some of those individual triggers, the specific factors that initiate IBD still need to be fully understood. There's a lot of research that still needs to happen, although several potential risk factors have been studied, and those include things like active smokers have a higher risk of developing Crohn's disease than non-smokers. So while the risk of developing ulcerative colitis decreases in current smokers, it still is higher than the general population. And it's interesting that usually we don't ever associate any positive results with being an active smoker, but it's interesting that the ulcerative colitis goes down. Still not going to encourage our clients to smoke. That's not the answer there. Just an interesting little tidbit. Also antibiotics. So there can be an increased risk of IBD associated with antibiotic use. Non-steroidal anti-inflammatory drugs, commonly called NSAIDs. So it's going to be things like aspirin, ibuprofen, naproxen. These medications can increase the risk of developing IBD and can trigger disease flares. Children who undergo an appendectomy, that's where they remove the appendix, are less likely to develop ulcerative colitis later in life, but may have a higher risk of developing Crohn's disease. And while IBD is not caused by any particular one food, obviously our diet and our choices in food can play a role in the symptoms and can aggravate symptoms. So particularly Crohn's disease and ulcerative colitis, it's an important area of research that requires a whole lot more investigation to understand its impact on the diseases. We've got a lot of opportunity for research there. So what can we use with clients with IBD? Medication adherence comes right up there. So assisting clients in understanding and adhering to their prescribed medications is crucial for managing IBD symptoms. So education, reminders, support to ensure clients stay on track with their medication regimen. Again, this is another opportunity in the platform. If you're practicing on the YourCoach platform, leverage the tasks feature, and that can help your clients set up their habit and get those timely prompts and reminders here. Also, dietary modifications. As advised by their healthcare provider, we're not going to give them any specific prescription for how to modify their diet, but IBD often requires dietary modifications to manage their symptoms and promote good gut health. So we can work with clients to implement dietary recommendations that were provided by that healthcare provider or registered dietitian. That can be things like avoiding trigger foods, following a specific diet. Some common ones are the low FODMAP diets, anti-inflammatory, ensuring proper nutrition all along the way. Symptom tracking can be really powerful. That's really helpful for identifying those patterns and trigger foods, and then evaluating treatment effectiveness as well. So when they start taking a new medication, they may want to track any symptoms along with that. We can really help clients establish a system for tracking those symptoms, such as a symptom diary or notating that, like we talked about in the food diary within the platform. There's a little notes feature that can keep those there. Or you can even use some of the tasks and they can add little notes and comments there. And that assists in gathering that data so that we can interpret that data and provide valuable insight for the client's healthcare team. And then, as always, stress management techniques. This is going to be a continual one. We know all about those. They're really powerful. And then if we have that opportunity in our working relationship, we can support our clients by effectively communicating with their healthcare team. So this can involve assisting clients in preparing for medical appointments, or maybe making a list of questions or concerns that they want to bring up so that they can effectively advocate for their needs. So let's look at another case study. David's a 40-year-old man who was diagnosed with Crohn's disease 5 years ago. He's been on medication and has made some dietary changes recommended by his gastroenterologist. It's a mouthful. However, he still experiences flare-ups and struggles with fatigue and weight loss. He's looking for additional support to manage his symptoms and improve his overall well-being. So if we look at David and we know that he's coming to us wanting to work on his Crohn's disease, what are your first thoughts? What coaching tools do you think are going to be effective in supporting him? Again, you can absolutely drop some of those things into the chat. I love having these interactive brainstorms because we all approach our clients just a little bit different, and they're all such helpful ways. So it's always really cool to hear from you guys. If I was working with David, my primary goal, of course, is going to be to support him in a comprehensive way. I really want to help him effectively manage his Crohn's disease. I want to help him improve his overall well-being. Again, can't say they're happy in humans. So to fully support David, I'd be curious about his current lifestyle, his challenges, his goals for managing his symptoms, and then I can tailor our coaching sessions to address his specific needs by understanding his unique situation. So I think one of the things that I would want to see and inquire about his interests would be his potential desire to keep a record of his symptoms, including the frequency, the severity, possible triggers, and this can help him identify patterns and then make informed decisions regarding his treatment plan. I'd also be curious about how he feels about his medication adherence. That's if he's consistent, any potential challenges that we could develop better habits around. And he mentions he's made some dietary changes, but this could mean he hasn't made all of the ones that have been recommended to him. So we could chat about what that looks like for him, what challenges he's run into, and if he thinks making those changes to his diet could help. In our sessions, of course, can't say it enough, we could work on more stress management techniques to really help David cope with the emotional and the physical toll of living with Crohn's disease. Perhaps he has a colostomy bag, right? That can be physically and emotionally difficult to navigate. So we could explore, on top of all of our stress management techniques like relaxation exercises, mindfulness practices, we may also need to talk about clothing options to make the colostomy bag more comfortable or more accessible. We may need to talk about the emotional toll of going out in a group and having someone notice the colostomy bag. How confident does he feel in talking about it? How does he handle and navigate those experiences? So we can incorporate all of that into the coaching sessions. Outside of that, also, he mentions wanting to lose weight. So maybe we discuss his diet and his exercise, identifying areas he feels like are an opportunity for improvement. I'd really want to ask him a lot of open-ended questions. This is true for any clients because it really encourages self-reflection and exploration. So for David, maybe it'd be something like, how do you currently manage your fatigue and weight loss? Or what area of your Crohn's disease management do you feel confident in? And what areas would you like more support? These questions really would allow David to express his thoughts, his concerns, and then enable me as the coach to provide personalized support and identify areas that we could work together on. I'd really want to emphasize the importance of self-care and self-compassion through it all. So even saying something like, man, managing Crohn's disease requires patience and self-care. It can be a lot. Let's focus on developing strategies that prioritize your well-being and help you navigate through flare-ups. Remember, progress is a journey, and I'm here to support you every step of the way. What does that first step in your journey look like for you? Or even maybe saying, David, you've shown great resilience in managing your symptoms so far. Let's explore additional strategies together that can empower you to regain control over your health and thrive despite the challenges of Crohn's disease. Lots of opportunities on what to do there. Not to rush through, I want to make sure we hit everything. So let's hop into gastroesophageal reflux disease. Whew, again, another mouthful. We're going to call this GERD from now on. It's a nice little short, simple acronym. It's a prevalent condition that affects a significant portion of the adult population in the United States, with approximately 1 in 5 or more men and women experiencing its symptoms. It's not exclusive to adults, and it can also occur in children. Unfortunately, GERD often goes unrecognized and its symptoms are understood. It's really important to note that GERD is generally treatable. So that's the good news. And proper treatment is crucial to prevent serious complications. So while heartburn is the most common symptom associated with GERD, it's essential to recognize that GERD can manifest in a variety of ways, and individuals may experience other symptoms as well. It's also possible to have GERD without experiencing obvious symptoms at all. Unfortunately, many individuals attempt to self-treat or misdiagnose their condition, which leads to an ineffective management of GERD. So it does typically require long-term treatment, even after the symptoms are alleviated. Addressing the challenges of daily living and ensuring compliance with medication is an important aspect of managing GERD effectively. So follow-up care and education are going to play a huge role in supporting clients with GERD. The symptoms of GERD can be distressing and have a detrimental impact on a person's quality of life. The symptoms, again, vary from person to person. We see this a lot, but some common symptoms are things like heartburn, It's the most prevalent condition, a symptom of GERD, and it's often described as a burning sensation in the upper chest or the upper abdomen. It typically occurs after meals or when lying down, and it may worsen when bending over or at night. Individuals with GERD can experience a sour or a bitter taste in their mouth. It's caused by that regurgitation of the stomach acid into the throat or the mouth. It can be unpleasant and they give that uncomfortable sensation. Some people can also get chest pain that can mimic a heart attack symptom. It's essential to differentiate between GERD-related chest pain and cardiac-related chest pain to ensure that appropriate medical evaluation. Remember, as coaches, we're not doing that. If someone has a chest pain, we're going to try to point them towards getting medical attention so the medical professionals can sort out where that source of chest pain is. Known as dysphagia, difficulty swallowing can occur from the acid in the stomach, and it irritates the esophagus, leading to narrowing or spasms. And this can make it difficult to swallow both solid and liquid foods. Persistent coughing or a sore throat that does not seem to resolve can be a symptom, and the irritation caused by that stomach acid can trigger a reflex in the throat, leading to coughing or that persistent sore throat. GERD can also affect the voice, causing hoarseness or a raspy voice. The acid irritates the vocal cords, leading to changes in voice quality. So again, this can vary wildly among individuals. There are also some risk factors for the disease, including excess weight and obesity can increase that abdominal pressure, including the lower esophageal sphincter. We're going to call that the LES, so lower esophageal sphincter, LES. It's a muscle that helps prevent stomach acid from flowing back up into the esophagus. When pressure on the LES increases, it can weaken or become dysfunctional, which again leads to the development of GERD. A hiatal hernia can occur when part of the stomach pushes upwards through the diaphragm and into the chest cavity, and the displacement of the stomach can disrupt the normal functioning of the LES, allowing that acid to reflux into the esophagus more easily. Pregnancy can increase the risk of developing GERD due to hormonal changes, the growing uterus, and that pressure it places on the stomach. Certain connective tissue disorders, such as scleroderma, can affect the normal functioning of the esophagus and the LES. And then gastroparesis, that condition where the stomach takes longer than usual to empty its contents, can delay and cause an accumulation of stomach acid, which then increases the likelihood of reflux. Again, anyone with GERD may have some of these symptoms, may have all of these symptoms, may have none of these symptoms actively. That's what makes this one really tricky. But as a coach working with someone who has GERD, there's several coaching tools and resources that we can use to support them. And you're going to see this one. You've never seen a pattern yet? Food diary informed dietary changes. We need to have some data to see what those trigger foods are, see what's causing, maybe what's complementing. This is going to be a really great source of information. Also, eating smaller, more frequent meals. So if clients eat smaller meals, spread their meals out through the day, it can help prevent excessive stomach distension and reduce the pressure on that LES. And then it can aid in maintaining better control over the acid reflux. Emphasizing the importance of maintaining a healthy weight can benefit clients with GERD, as obesity is a risk factor, right? And then elevating the head of the bed. So if a client elevates the head of the bed by using a wedge pillow or placing blocks under their bedpost, that can help reduce the occurrence of the nighttime acid reflux. That elevation prevents the stomach acid from flowing back into the esophagus during sleep. And stress reduction techniques. Again, we've talked about these, they're great. And encouraging clients to avoid consuming large meals or snacks close to bedtime can minimize the likelihood of acid reflux during sleep. It's generally recommended that they allow a few hours for digestion before lying down after a meal. So case study, let's look at Olivia. Olivia is a 50-year-old woman who's been dealing with GERD for the last year. She often experiences heartburn after meals and has noticed it interfering with her sleep and daily activities. She's tried over-the-counter antacids, but they provide only temporary relief. So she seeks guidance on managing her symptoms through lifestyle changes. Again, I'd love to know what your thoughts are about Olivia. What go-to tools or skills would you lean into for her? You definitely feel free to drop those in the chat. Jen, I do see your comment as well about needing to hop off. Totally understand, life happens. Yes, you will get an email. So we'll talk more about that at the end as well. So as a health coach working with Olivia, my primary goal would be to fully understand her experience with GERD and then provide her with the necessary support and guidance to manage those symptoms effectively. So again, open-ended questions, insights into her lifestyle, triggers, and current coping strategies. So some questions I might ask Olivia include things like, tell me more about your experience with GERD. How's it been impacting your daily life and your well-being? What specific situations or foods seem to trigger your heartburn? Or what strategies have you tried so far to manage your symptoms? How effective have they been for you? In order to fully support Olivia, I would utilize various coaching tools and skills tailored to what her answers are to those questions and her specific needs. So again, this could include food diary and informed dietary changes, lifestyle modifications, like eating those smaller, more frequent meals, avoiding late night eating, elevating the head of her bed, maybe even saying something like, there are some small tweaks that leading resources recommend to help with GERD symptoms. You may have read about them, or you may have been given information on them by your doctor. Would it be helpful to explore some of those lifestyle modifications together that could maybe support you in your symptom management? I'd also want to be mindful of any concerns or challenges that she's faced along the way. She may struggle with implementing dietary changes or manage stress levels. She may be cooking and feeding an entire family, and maybe her family doesn't like the type of foods that she needs to be eating for her changes. We can navigate that together. Really providing that support, that encouragement, that accountability. So even saying things like, I understand that making dietary changes can be challenging, but remember, you're not alone in the journey. I'll be here to support you every step of the way. Have you ever had to make a change that you thought was too challenging and succeeded? Tell me about it. That can really help her tap into her self-efficacy and then find strategies that we can lean into and apply to this scenario. Again, coaching is all about be attentive, be empathetic, supply them with resources so that we can help be knowledgeable and informed and empowered. And that can really impact overall well-being and help our coaching sessions be productive. Water break. All right, we're in our home stretch. We're going to talk about celiac disease. It affects an estimated 3 million Americans, with approximately 60 to 70% of cases going undiagnosed. So that's a huge percentage of undiagnosed. Its common symptoms are digestive issues, so things like diarrhea, constipation, bloating. It disrupts the normal functioning of the small intestine, leading to those gastrointestinal problems. So the damage to the intestinal lining can affect the absorption of nutrients, which leads to changes in bowel habits. Individuals with celiac disease may experience abdominal pain, which can range from mild discomfort to severe cramping. The pain is often related to the inflammation and damage in the small intestine caused by the body's immune response to gluten. Unexplained weight loss is a common symptom of celiac disease. The damage to the small intestine can impair nutrient absorption, particularly fats and carbohydrates, leading to weight loss despite calorie intake. Chronic fatigue is frequently reported by people with celiac disease. It may be a result of malabsorption of nutrients, anemia, that's a low red blood cell count, due to iron deficiency, or the overall impact of the immune system's response on the body. There could also be dermatitis herpetiformis. Again, we've got lots of mouthful words there. It's a skin manifestation of celiac disease characterized by an itchy, blistering rash. The rash typically appears symmetrically on the elbows, the knees, the buttocks, and the scalp, and it's caused by an immune reaction to gluten, and then can be an indication of underlying celiac disease. Might also experience joint pain or arthritis-like symptoms. The exact cause is not fully understood, but it could be related to inflammation triggered by the immune response. It's important to note that the presence and the severity of symptoms, again, like everything else, varies among individuals with celiac disease. So some individuals may experience only a few symptoms, while others can have a wide range of manifestations. There are some risk factors for it. Having a first-degree relative, again, that parent, sibling, child with celiac disease significantly increases the risk. There is a genetic component to the disease, and having a close family member with celiac disease raises the chances of developing it. Individuals with type 1 diabetes have a higher risk of developing celiac disease. So the two conditions share similar genetic and autoimmune components, and it's recommended generally that individuals with type 1 diabetes also be screened for celiac disease. Down syndrome and Turner syndrome are genetic disorders associated with an increased risk. It's important to be aware of the heightened risk and then monitor for celiac disease symptoms in individuals with those syndromes. Again, that's for their medical professional. We don't have to worry about that, but I do think it's good to know. There's also a known association between celiac disease and autoimmune thyroid diseases such as Hashimoto's thyroiditis, Graves' disease. Autoimmune diseases often coexist, and individuals with autoimmune thyroid disease should be vigilant about the possibility of having celiac disease. And then microscopic colitis, that's a group of conditions that cause chronic diarrhea. Both lymphocytic and collagenous colitis have been linked to an increased risk of celiac disease. The exact relationship between those conditions is not really fully understood yet, but individuals with microscopic colitis may benefit from celiac disease screening as well. And then Addison's disease, that's a condition characterized by the adrenal glands not producing enough hormones, has been associated with an increased risk of celiac disease. So all of these routine screenings with these risk factors can be a great idea. Again, they're just risk factors. It doesn't mean someone's going to develop celiac disease just because they have them. So what tools can we use? Strict gluten-free diet. It's a cornerstone of celiac disease management. It involves completely avoiding foods and products that contain gluten, such as wheat, barley, rye, and all of their derivatives. We can provide support in understanding which foods are safe and which ones should be avoided. And there's also usually an emotional toll of navigating a world filled with gluten. It can be really tough. At the beginning of this call, at our webinar here, I was sharing my son actually has celiac. So we've navigated some of this, and being a child, going to birthday parties, going to class even, and having snacks, it's a whole different world to navigate from an emotional standpoint as well as a physical standpoint. Of course, education on hidden sources of gluten. It's present in various food products and ingredients that may not be obvious. So we can help provide resources to educate individuals about hidden sources of gluten in places like food additives, cross-contamination, processed foods. This can really help our clients make informed choices and avoid unintentional gluten exposure. And the huge piece, learning how to read food labels accurately. It's really crucial for individuals with celiac disease. So we can help inform and educate clients about how to identify gluten-containing ingredients on food labels and provide strategies for navigating the labeling process effectively. This empowers clients to make informed decisions when they're purchasing food products and feeling more empowered at the grocery store. And of course, support meal planning and dining out. Meal planning can be a challenge for individuals with celiac disease, particularly if they're used to cooking a certain way and now everything is changing. And then they also want to maintain a balanced diet while navigating all of these changes. And we can really support clients in developing meal plans that meet their nutritional needs and provide practical tips for dining out safely. It can really help them navigate social situations, again, which can be challenging, enjoy dining experiences out without compromising their health. Again, side note here, we don't write, as health coaches anyway, we don't write individualized meal plans. That would fall into the territory of a registered dietitian. But we can help clients develop strategies to implement their doctor's recommendations, their RD's recommendations, CDC MyPlate, and fit all of that together. We can help them identify recipes that would work for them. Lots of opportunities to work in there, still within our scope. Also with that, celiac disease can lead to nutritional deficiencies due to malabsorption issues. So we can help individuals identify potential nutrient gaps and collaborate with them to develop those strategies for meeting nutritional requirements through that gluten-free diet. Again, this falls in line with what we were talking about before with the medical professional RD's recommendations. And so many social functions revolve around food. So helping them feel comfortable expressing their dietary needs, having a plan with emergency snacks that they carry with them perhaps, and preparing emotionally to perhaps not engage in the same foods as others at the table can be really, really helpful and really impactful to help them navigate. I know we're getting close to the end. We're almost there. Hang in with me. We'll just go just a few minutes over, but there's some really good information I don't want you to miss. So let's look at Liam. He's a 28-year-old man who was recently diagnosed with celiac disease. He's been struggling to adjust to a gluten-free diet and feels overwhelmed by the restrictions and hidden sources of gluten. He seeks guidance on managing his diet and ensuring he receives proper nutrition while avoiding gluten. As a health coach working with Liam, my primary goal right off the bat is going to be to provide him with guidance, give him support, give him what he needs to effectively manage his celiac disease and feel confident, feel supported, help him embrace that gluten-free lifestyle. I'd want to be curious about his current understanding of celiac disease. What's his experience with the gluten-free diet been so far? Has he tried some of the bread and it tasted like cardboard and he's feeling defeated? Like, let's talk about that. Let's talk about what could be good options. We can talk about any challenges or concerns that he may have. I'd also obviously want to have any resources on hand for education on celiac disease and gluten-free diet, really understand his understanding of the celiac disease, the symptoms, the concerns, the challenges that he feels like he's facing or may face in the future. Really want to him to create a list of questions for his clinician, if that would be helpful or necessary. That way to really help him understand, what to expect. We can even navigate, again, some of those food labeling concerns, hidden sources of gluten, how to read labels effectively. I know it can be really confusing when you're starting to read labels. Like, what are all of these words? Did you know that when they're listed, the most prevalent ingredient is first, working down to how much is in the product? What do all of the pieces on the label mean? We can talk about all of those things. I've had people, in our life who think gluten-free means, fat-free, or means not processed, and so really some education around that to understand what it is and what it isn't. I can even say something to Liam, like, understanding the intricacies of a gluten-free diet can be overwhelming, but with knowledge and practice, you'll become confident in identifying safe food choices. What's one thing you could do right now to help you feel more confident? Let's take that first step to build that confidence. Again, we can talk about recipes. We can focus more on what he can eat versus what he cannot eat to help him feel like there's still a vast world out there of delicious food that he can enjoy. Even saying something like planning and preparing gluten-free meals can be enjoyable and empowering, but it may feel like a huge shift, and that can be overwhelming and really sudden. Let's work together to create a meal plan that fits your lifestyle and supports your nutritional needs. How does that sound to you? Again, as a coach, I'm not building his meal plan, but I'm supporting the client and utilizing recipes that they're interested in and resources that they have to build it. Again, listening to Liam's experiences, validating his feelings, providing ongoing encouragement and motivation, regularly checking in with him to assess his progress, address those challenges and setbacks, celebrate his achievements. Maybe he found a gluten-free recipe this week that he really loves. Let's celebrate that. Just so many opportunities to support. Now, I want to revisit just briefly that question at the beginning as we contemplate our key takeaways. How confident do you feel in coaching around gut health? We asked at the beginning, at the end of this webinar, on a scale of 1 to 10, with 1 being that immense anxiety and that desire to run away, to 10 being fully confident and ready to tackle any gut health challenge that your client brings forward. Where do you land? I'd love to see it. You can drop it in the chat. You can drop it in the Q&A box if you want to remain anonymous. Just love to see that. Our key takeaways today are: gut health is vital. A healthy digestive system is essential for overall well-being. And health coaches play a crucial role in supporting clients with gut health issues to improve their quality of life. Matter of fact, you're going to see sneak peek tomorrow. We do these deep dives very regularly. They're on our website, they're on our socials, and they give you the latest research on health coaching and various conditions or populations. And we're going to have one on gut health that's going to come out tomorrow. So you're going to see that. You can subscribe to them so you get them right in your inbox. You can do that on our website. And of course, they'll be posted on our socials as well. But it's going to be coming out, and it's got all the latest research around health coaching and gut health. So it's beautiful. Be sure to check it out. And it's laid out in such a beautiful and easily digestible way. So definitely encourage you to check that out. And our other key takeaway: coaches must work within their scope of practice and collaborate with healthcare professionals when necessary. We don't have to be the experts in gut health. We are the experts in behavior change. So we can collaborate with those that are the experts in gut health to see how we can best support our clients. So as we're wrapping up our presentation, of course, I want to personally extend an invitation for you to join our coaching community. We have a ton of helpful resources available to help you manage your coaching practice. That's from our dynamic practice management platform to the coaches resource library filled with tools. And you see a sneak peek here. There is going to be a brand new gut health tool that's going to be located in the coaching resource folder by next week. So this is a really neat document. It's got some fun facts about gut health, some coaching questions to consider, and even some challenges for gut health that you can use to support your clients. We're really passionate about the health coaching revolution, and we would be thrilled to have you join us on the platform. There's no cost to join, and you can access it through the App Store, Google Play, or any web browser at YourCoach.health. Before you go as well, I would love it if you would take just a brief moment to drop in the chat what topics you would love to see a CEU webinar on. As part of our dedication to supporting you, our coaching community, we want to hear from you on what topics are most beneficial for you to learn about. We do these to benefit you. So tell us what you would like to learn about the most. Also, if you registered for a CEU ticket, keep an eye on your email inbox over the next 24 hours for a link to the quiz. Really appreciate your presence here today, your interaction, your energy that you brought, and for showing up so that you can learn more, to better create more happy and healthy humans. So again, I encourage you to be on the platform and be part of our coach community, and we'll see you on the platform soon. Thank you, everyone. Have a great rest of your day.